Every night you go to bed hoping to rest, but if you're sleeping the wrong way, you might be unknowingly damaging the blood vessels in your brain. As a brain and nervous system specialist, I want to warn you before it's too late. A recent Harvard study shows that waking up more than 3 times a night increases the risk of forming blood clots in the brain by 74%, one of the leading causes of stroke in people over 70. Moreover, poor sleep posture, lack of oxygen during sleep, or using the wrong pillow can gradually weaken brain blood vessel function over time. In today's video, it'll help you discover 5 important sleep factors that no one tells older adults about and show you how to improve your sleep to reduce stroke risk. And the most surprising one, number 4, has to do with the nightlight in your room. Don't let poor sleep take away your precious independence. Let's explore each of these together right now. The first thing you need to pay attention to is the habit of eating heavy, hard-to-digest foods too late at night. This is very common among people over 70, yet it quietly raises the risk of stroke during sleep. As we age, our bodies don't process food as efficiently as before, metabolism slows down, and digestion weakens significantly. That's why what and when you eat directly affects your sleep quality, blood pressure, and risk of sudden complications at night. So why is late-night eating dangerous? When you eat a full meal right before bed, your stomach has to work overtime producing acid instead of resting. Excess acid can reflux into the esophagus, causing heartburn, coughing, or even choking sensations that wake you up at night. If this becomes Crohn's gastroesophageal reflux disease, GERD, it can damage your throat and increase the risk of aspiration pneumonia, a serious illness especially dangerous for older adults. Moreover, your heart works harder. Normally, your heart rate slows down to recover during sleep, but a heavy late meal keeps it active, stressing your cardiovascular system, making deep sleep harder, and raising the risk of heart problems, including stroke. Eating sugary or starchy foods before bed can also spike blood sugar, making glucose harder to control during sleep, especially for diabetics, further increasing cardiovascular risk. Studies show that seniors who frequently eat late at night often face metabolic disorders, key contributors to heart disease and stroke. What's the solution? Try to finish your last meal at least 3 to 4 hours before bedtime, giving your body enough time to digest. If you feel hungry near bedtime, choose light, easy-to-digest snacks like a small handful of nuts, a piece of fruit, or a cup of warm, unsweetened herbal tea. Remember, your body at this age needs special care, and small changes in eating habits can bring big benefits, reducing nighttime health risks, improving sleep, and creating the best conditions to effectively prevent stroke. Habit 2. Drinking too much water right before bedtime. A habit that seems healthy but poses risks for people over 70. Staying hydrated is essential, but consuming large amounts of fluids, whether water, tea, or juice, just before sleep can cause serious problems. At an older age, the bladder doesn't hold urine as well, and the body becomes more sensitive to fluid changes, making frequent nighttime trips to the bathroom disruptive and potentially hazardous. One of the biggest risks is falling. Suddenly waking up and rushing out of bed with a full bladder can cause orthostatic hypotension, a drop in blood pressure, upon standing, leading to dizziness or even fainting. This is a common cause of dangerous nighttime falls, resulting in fractures, head injuries, and complications related to stroke. Frequent nighttime urination also disrupts deep sleep because turning on lights interferes with melatonin production, the hormone essential for restful, restorative sleep. Poor sleep quality over time weakens the immune system, raises blood pressure, and can even accelerate cognitive decline, increasing the risk of memory loss and stroke. So, how can you adjust your drinking habits safely? Drink most of your daily fluids earlier in the day and taper off in the afternoon and evening. If you feel thirsty at night, take only small sips. Avoid diuretics like coffee and tea late in the day. Remember that hidden fluids can come from soups, fruits, or certain medications. These small changes can improve sleep, reduce fall risk, and support heart health, a key factor in lowering stroke risk. Additionally, many older adults prefer a warm bedroom with heavy blankets to sleep better, but sleeping in a room that's too warm can silently harm heart health and increase stroke risk. Aging reduces the body's ability to regulate temperature, making it easier to overheat during sleep. This forces the heart to work harder to cool the body, putting extra strain on the cardiovascular system, especially in those with heart disease, high blood pressure, or circulation problems. The most serious risk is nighttime dehydration. Even if you don't feel thirsty, a too warm room causes sweating, which thickens the blood and raises the chance of blood clots, the main cause of heart attack and stroke. If you wake up drenched in sweat and restless, it's a sign your body is struggling to cool down. A hot sleeping environment also disrupts deep restorative sleep. Conversely, a cool bedroom helps the body lower core temperature, naturally promoting deep sleep, strengthening memory, and boosting immunity. Experts recommend maintaining an ideal bedroom temperature between 15.5 and 19.5 degrees Celsius, 67 degrees Fahrenheit. To keep your bedroom cool yet comfortable, use multiple layers of lightweight cotton blankets instead of heavy synthetic ones. Wear breathable, sweat-wicking sleepwear and improve air circulation by opening windows when weather permits or using a small fan. These simple changes not only reduce strain on your heart, but also improve sleep quality, helping you wake up feeling refreshed and actively lowering your stroke risk. Habit 3. Sleeping in the wrong position. A silent burden that significantly affects the heart and brain, especially for those over 70. Few realize that the way you sleep every night can strongly impact your health and directly influence your stroke risk. Poor sleep posture not only lowers sleep quality, but can also cause breathing problems, hinder blood circulation, and increase stress on the heart. As we age, muscle tone, lung function, and circulation all decline. Maintaining an unsuitable sleep position for long periods can limit airflow to the lungs, reduce blood oxygen levels, and increase pressure on blood vessels, forcing the heart to work harder. Over time, these effects contribute to loud snoring, sleep apnea, and a higher risk of heart failure, factors that all raise stroke risk. Sleeping on your back is a classic example of a risky position for older adults. Although lying on your back may feel comfortable, gravity pulls the tongue and soft tissues in the throat downward, blocking the airway and causing obstructive sleep apnea. OSA. OSA disrupts breathing multiple times each night, significantly increasing the risk of cardiovascular disease, high blood pressure, and sudden cardiac arrest, all stroke-promoting conditions. If you often feel tired or have headaches despite adequate sleep, or if loved ones notice loud snoring with pauses in breathing, sleeping on your back might be the main culprit. Even sleeping on your right side isn't ideal. Studies show this position adds pressure on the heart and reduces blood circulation efficiency, which is especially dangerous for those with heart disease or congestive heart failure. So what's the best sleep position? After age 70, experts recommend sleeping on your left side as much as possible. This position improves blood flow, helps the heart pump more efficiently, and supports better digestion. For those with acid reflux or heartburn, sleeping on the left side also reduces symptoms and improves sleep quality. To maintain an ideal sleep position, use a body pillow if you find it hard to stay on your side. Slightly elevate your head with a supportive pillow, not too high to keep airways open. If you have joint pain, placing a thin pillow between your knees when lying on your side helps keep your spine aligned, reduces pressure on your back, and increases comfort. These small adjustments can make a big difference in your health. Ensuring your body is positioned optimally for circulation, breathing, and heart function not only lowers the risk of nighttime complications, but also promotes deep restorative sleep, helping you wake up refreshed and playing a vital role in effective stroke prevention. Habit 4. Using phones or tablets before bedtime, a modern and common habit that actually poses serious risks to sleep quality and heart health in older adults. Using electronic devices like phones, tablets, or watching TV too close to bedtime can harm you more than you think. Why is staring at these screens bad, especially in relation to stroke risk? One main reason is the blue light emitted by screens, so it can trick your brain into thinking it's still daytime. As a result, melatonin production, the hormone that regulates sleep-wake cyclesis, suppressed, making it harder to fall asleep, causing shallow, restless sleep with frequent awakenings. Poor sleep quality over time leads to serious consequences. Insufficient deep sleep can raise blood pressure, cause irregular heart rhythms, and trigger inflammational factors that increase stroke risk. Additionally, stressful content you view or interact with, like breaking news, social media arguments, or intense games, keeps your mind alert, opposing the relaxation needed for good sleep. Prolonged stress and anxiety also raise blood pressure, adding to stroke risk. Moreover, getting caught up scrolling through your phone, watching more videos, or reading news steals precious sleep time. Your body needs to recover. Chronic sleep deprivation harms overall health and raises stroke risk. How can you reduce these negative effects? Try to stop using all electronic devices at least 1 to 2 hours before bedtime. Ideally, keep these devices completely out of the bedroom. If that's difficult, turn them off or switch to airplane mode to avoid light and notifications disrupting your sleep. Instead, spend your valuable pre-sleep time on relaxing activities like reading a paper book, listening to soothing instrumental music, simple meditation, journaling, or soaking in a warm bath. By changing your bedtime device habits, you set the stage for quality sleep, protect your heart and brain health, and play a vital role in stroke prevention. Stay tuned for more videos to learn about stroke signs and effective prevention methods.